government's finally gone ahead and approved the rapid test?
Well, this is the third one that we've approved. Yeah.
Okay, and so, I mean, yesterday you bought them, today you approved them. Like, that seems awfully convenient, the two together.
Well, no, actually, we've been working really closely with procurement so that we can understand which tests are likely going to get approved based on the confidence the regulators have in the information that's being provided by the manufacturer. And of course, not waiting to order these tests because tests are in high demand of a variety from a variety of countries. And so the regulators have a good sense of what is looking promising and communicate on a regular basis with procurement, and that way we can kind of keep the ball rolling in all of those areas.
This is going to give Canadians a lot of hope that testing lines are going to vanish overnight, but that's not really the case, is it?
Well, this is the challenge with the whole conversation about testing. It is a complex space. These test kits will be allow for point-of-care testing, but they still are going to be used in very specific settings. They may be useful, for example, in long-term care settings where there has to be deeper screening. They may be used in rural and remote communities. That'll be really at the determination of the provinces who will have access to the technology. But at the end of the day, what really matters is testing the right people in the right place at the right time. And I think as provinces evolve their testing strategies to be in line with provincial testing guidance that's been agreed upon, by the way, by all chief medical officers of health, we're going to start to see a more efficient use of testing for the right purposes.
And I guess is that the ultimate, like, what's the ultimate goal? The ultimate goal for any Canadian to be able to get a test when they need it and to get results quickly, or how do you frame this in the larger context?
Well, I think the phrase "when they need it" is really important because part of a testing strategy is really understanding where you're best using your resources. For example, today you could go get tested for another disease, but it might not be necessary, right? So the idea is that medical officials across the province are working really closely to make sure they understand and evolve a testing strategy. I also work with my colleagues, the ministers of health, and we'll have very shortly a new national testing and screening strategy with updated information and guidance for all of the provinces and territories, and then the provinces and territories can use that to develop a strategy that works best for them in their jurisdictions.
And how does that fit in with the surge capacity task force or whatever it was that was promised in the throne speech?
Yeah, so we do actually have that underway right now. So for example, we have underway right now in the city of Ottawa, either plans to or it might be in place already, a surge capacity to help with some of the testing overflow that they're seeing. The idea behind our surge capacity or rapid response program is that no matter where there's a surge happening in the country, we want to have an all hands on deck kind of approach. So maybe people will need testing, maybe people will need contact tracers, maybe people will need isolation centers to separate sick people from healthy people in large settings. All of those kinds of tools are available, and we work closely with local public health as well as provinces and territories to understand what we can do to help them bring those case numbers down.
Okay, thank you. Announced today, is that a signal more is coming rapidly, or is it just going to tick out?
The regulators will continue to do their job and evaluate the tests that have been that companies have applied to sell in Canada, and you can anticipate more approvals as the regulators get the information they need from the manufacturers.
Thank you.
Thank you very much.
Yes, thank you so much. We had a marathon session last night, as you all know, and we're able to secure the two major wins for Canadians. They've been passed now. Canadians can count on the same level of support, the $2,000 per month, and now the legislation is passed for paid sick leave, which will help millions of Canadians. We're really proud of the work we put in to fight for Canadians and deliver this meaningful support. On est tellement fiers du travail qu'on a fait pour réaliser deux choses, le même niveau d'aide aux gens. On a arrêté le gouvernement libéral de couper l'aide aux gens. Et deuxièmement, maintenant, le projet de loi est passé qui va mettre en œuvre un congé des maladies payé fédéral, quelque chose qui va aider des millions de travailleurs et travailleuses à travers le pays. Ready for any questions?
All right, we'll start with question on the phone. We have about 10 minutes for question total, so please keep it short. One question, one follow-up per reporter. Operator, do we have a first question?
The first question is from Libertion from the Canadian Press. Please go ahead.
Yes, Mr. Singh. I just wanted to ask you about the NDP support for speeding this or fast-tracking Bill C-4 through the House of Commons. You were criticized. The NDP was criticized this morning by the Bloc and the Conservatives for this decision. Can you explain why the NDP supported the fast-tracking of Bill C-4?
For people, without any question. There's millions of Canadians that no longer have access to CERB and they can't go back to work. So they need help. And while the Liberals can be criticized for their poor timing of bringing a throne speech in and not giving us a lot of time to make sure legislation was in place to help those Canadians out, there's no question for me. If millions of Canadians are worried and wondering how they're going to get help, we are going to do everything possible to make sure legislation is passed as quickly as possible to get them that help. There's families that were waiting, kept on checking the website to know, will they be getting help? Is there any help coming? So we had to work quickly for those families.
Follow up?
Ms. Vivi, follow up?
Is there a follow up, Louis?
I'm trying. Can you hear me?
Yeah. Yeah, we do.
Can you hear me?
Yeah.
Okay. And as a follow-up, do you have any concerns that by fast-tracking this legislation, there may be gaps within it, that the NDP and the Conservatives both spoke about the importance of analyzing and improving legislation that's part of the democratic process? Do you have any concerns that by fast-tracking it, there will be gaps and there will be Canadians who fall through the cracks? And how do you respond to allegations that basically at this point in time, there's no big difference between the Liberals and the NDP?
We can start off by saying that this is something we fought for. This was something the Liberals were opposed to. They didn't want to bring in paid sick leave. We fought for it in May. This was our win. This is New Democrats that fought for paid sick leave, not a Liberal idea or an initiative. New Democrats fought for it because Canadians needed it. And the Liberals were going to cut the help that Canadians receive. They were going to cut it. That was the plan. They announced it. They made it very clear. Everyone was aware of it. Media had access to their proposal. They were going to cut the help that Canadians receive, and we fought back. So this is a stark difference. We believe in maintaining and keeping support for people in need and putting in place paid sick leave. The Liberals didn't believe in that. We fought and we won for Canadians. The Conservatives and the Bloc have done nothing throughout this pandemic. There's not a single win they can point to that they've helped out Canadians. I mean, I think that's a pretty bad record. They cannot point to a single thing, and they're complaining that we got help for people quickly. That's their only complaint. Like in a pandemic, the only criticism that the Bloc and the Conservatives can raise is that the NDP fought to get help to people too quickly. That puts in perspective how little they've done for people.
We'll now take a question in the room before going back to the phone. Mackenzie?
Hi, Mr. Singh. Mackenzie Gray with CTV News. Today, Health Canada approved the Abbott Labs test that the federal government bought yesterday, about 8 million rapid tests. So 2 questions for you about that. I just want your reaction to the test being approved today. But yesterday, Health Canada said that we basically have different standards in the U.S. when it comes to approving tests. In the U.S., they'll approve tests that may be effective. In Canada, we approve tests that are known to be effective. With the testing backlog that we have now, should Health Canada move to a standard that the U.S. has, where we approve tests that we think are effective, put them in the market and see how it goes, or are you happy with how we have things right now?
I think it's rarely a good idea to follow what the American government is doing when it comes to their standards for healthcare, their handling of COVID-19. I think it's pretty safe to say that Canadians don't feel a lot of confidence in the way America has been handling this pandemic, and the results show. Our focus on making sure anything we make, any decision we make is based on sound evidence and is definitely going to help is a good thing. There should be one point really clear. In Canada, we should never allow ourselves to fall into any sort of politicizing of evidence when it comes to approval or not approving any sort of medication, testing. That's what's special about Canada is we've got a public healthcare system where there is not a profit motive, and we need to make sure we protect first and foremost that any decision we make is in the best interest of Canadians. That principle, that value is very important to our healthcare system, and we need to protect it.
During the debate last night between Mr. Trump and Mr. Biden, President Trump called in his supporters to basically go outside polling stations and make sure that the vote was fair, something that has been outlawed for an extended period of time. Do you have any concerns about the legitimacy of the U.S. election with claims like this being brought forward now?
I have incredible concerns. I'm shocked, and I'm shocked that I can still be shocked given President Trump's horrendous behavior and commentary throughout his presidency. The fact that we can still be shocked at the things that he's saying, it's clear that he is directly trying to attack democracy, the ability of people to vote, discouraging people to vote, and actively encouraging people to effectively intimidate people to vote. I mean, it should be as easy as possible and as accessible as possible to vote. And it is beyond, I don't have the words to describe how horrible all the commentary of President Trump, and particularly one comment around his complete unwillingness. You know, he was so dismissive about the idea of white supremacy. Something should be obvious that yes, it's a massive problem and it divides people and it hurts people. The fact that he couldn't say that, and on top of that, he effectively endorsed a right-wing violent group, the Proud Boys, is appalling. His behavior is appalling.
We'll now go back to the phone before coming back to the room. Operator, do we have another question?
Thank you, merci. The next question is from Hélène Buzetti, Le Devoir. La parole est à vous.
Oui, bonjour, Monsieur Singh. On apprend que le projet de loi C4, au départ, devait coûter 29 milliards, mais finalement, avec les bonifications que vous avez obtenues, c'est 34 milliards, donc 5 milliards de plus. Il y en a qui diront que ça fait cher un peu pour garantir la survie du gouvernement minoritaire de Justin Trudeau, que finalement, vous êtes un appui qui coûte cher. Qu'est-ce que vous répondez à ça?
Je pense que le COVID-19 coûte cher, c'est la réalité, et ça va coûter plus cher si les travailleurs et travailleuses ne peuvent pas rester chez eux s'ils tombent malades. Donc, c'est essentiel dans une pandémie de maintenir l'aide aux gens et aussi de mettre en œuvre un programme de congés de maladie payés pour s'assurer que les gens peuvent retourner au travail. C'est fondamental. Donc, pour nous, c'est toujours le cas qu'on est prêt de faire les investissements dans les gens. Et pour les conservateurs, ils vont couper l'aide aux gens. Ils vont parler des déficits, mais ils ne sont pas prêts de parler des plus riches qui ont fait des profits records. C'est eux qui doivent payer le prix pour le COVID-19.
J'ai pas vraiment de suivi. Merci.
Merci.
And back to the room. You have a question?
Jagmeet, this is Mal Hamidi. I'm with the Canadian Press too.
Hi there.
I want to go back to the rapid testing again. So Health Canada, as you know, approved the rapid COVID-19 test, but it's yet not clear when the test will be available to health professionals to use it. Do you think the government is being transparent enough about rapid testing and what the government is doing, what it is doing regarding this?
I believe that decisions around what is approved, testing that's approved, medication that's approved, should all be very much science-based and free from political interference. It should be decisions that are in the best interest of Canadians, based on the best available evidence and the highest standards. I think those are fundamental principles when it comes to the approval of any sort of medical healthcare-related decisions. And that's something that I think we need to uphold and ensure there's absolute transparency and that it's strictly evidence-based and in the best interest of Canadians.
How, as a follow-up, how do you evaluate how the government has how it has dealt with this so far in the last few months?
I've raised concerns about the help that Canadians receive and the lack of appropriate funding and supports for testing, and the fact that there's massive lineups and families are worried. Those are all very legitimate concerns. In terms of specifically of the approval of testing, that's something that I think should remain fully and completely evidence-based, and I'm open to continuing to strengthen our ability to do that and make sure there's better transparency. I've got concerns about the fact that we've had to fight the government to deliver more help to people, but when it comes to the evidence-based decision-making for Health Canada, that's not where I would put my criticism.
And I'll check one last time on the phone if we have one last question, one follow-up.
There are no further questions at this time.
Thank you. Merci.
Thank you. Merci.